and welcome everyone to Prep Hour with Steve. This is our 5th session in the series, and I welcome you to wherever you are in the world, whether you're in Australia, whether you're in the UK, perhaps you're in the Middle East, perhaps you're in some other region of the world, and a very big welcome. If you could all just type in, say hello. My name is Steve McPhail, and I'm here in Brisbane, Australia. If you could just text in your comment of where you're located in the world and what time it is now. It's 8 a.m. here in Brisbane, and I'll just turn on, I'll just check out the comments as they come in. All right, well, I can see lots of people making their comments in now. That's great. Joseph is in Dublin. Hello to Joseph, where it's 10 p.m. Welcome. Hello to Asha over there in New Zealand, where you're a little bit ahead of us here in Australia. It's 11 a.m. We have a guest from Egypt, where it's just turned midnight. Hello to Mushtaf down there in Melbourne, where it's 9 a.m. Getting some people from Egypt here, and 1:30 in the morning for Asadeh in Iran. Thank you for staying up tonight for this event. Welcome to Nevachan. Hello, Leah. If any of our students here in Brisbane are here now, welcome. And one more question I'll ask, what are you using to watch this? Are you using your mobile phone? Are you using a laptop? Are you on your desktop? Perhaps you're on the bus on your way somewhere watching on your mobile. Hello to Kim in Sydney. All right. Well, great to see people from all over the world. Now, it's going to be an interactive session, so you will be able to type in questions because we're going to actually write a section of a referral letter today. That's why a laptop is very good for that, but you can certainly use your phones. Got some people on the phone, some people on the laptop. That's fine. You can just enjoy the video and not comment if you wish, or you can make comments as we go. So whatever device you're using will be fine. All right, well, I think we'll get started. So we're going to focus today, everyone, and it's going to be an urgent admission. As we can see here, and I'm going to paint a bit of a picture first so you understand the scenario of these case notes, because I won't show you the full set of case notes. So you can see on this image now we have a map of Australia, and we have the Royal Flying Doctor Service. We can see an aeroplane there. You can see it's in a remote area, and I wonder if you can describe what you're seeing on this image. While you're thinking about what you're seeing, this setting for this case is over here in Western Australia. Australia's a big country, as I'm sure many of you know. Personally, I'm based over here in Brisbane on the East Coast, but this scenario is in Western Australia on the West Coast. We've got Perth down the bottom, and this patient is being evacuated by the Royal Flying Doctor Service. So that's the image we can see. And he is, just to paint the scene a bit, he's a worker in a copper mine in the Pilbara region of Australia, which is somewhere around here. It's a long way from anywhere, and he has to be airlifted down to Perth, which is like at least 1,000-kilometre journey. So it's a long way to go. There's very few roads, and because this is an urgent admission, this patient is actually being evacuated by the Royal Flying Doctor Service. Yep, and everyone's writing in. Hello to Augusto out there in Portugal, welcome. So it's an evacuation, everyone. So that sets the scene for us. Now, when you get a case like this, there's two ways that we can approach it in our planning. Two ways you can write referral letters, where you can use a chronology approach or you can use an order of importance. So if we took the chronology approach, we'd write our introduction, perhaps stating the urgency of the situation, and then you'd move on to the past medical history or social history. In this case, it could be the first consultations. You might talk about the progression of the illness, and then in the last paragraph, you're going to put all the details of the current condition or the most recent consultation, and then you write your conclusion. So that's your chronology approach. A second approach is what we call order of importance. So we still write our introduction, but then we go straight into details of the current condition or the most recent consultation. In this way, the reader knows immediately the details of what's happened most recently. He doesn't have to wait and work through the history. He knows immediately. And then the less relevant information like the past medical history or social history is mentioned, and then we have a conclusion. So it's really just a different way of ordering it, and it does depend on how you want to structure your letter. So you have a decision to make there on which approach you make. And I suggest you practice different styles to improve your own writing. You can even get a set of case notes and write the same set of, look at a same referral letter based on a set of case notes, practicing each style. They both have their place, and it depends on the situation. Now, to help demonstrate this lecture, we're going to use the chronology approach, so that because I want to set the scene for you so you know a little bit about this patient before we put the details of the current condition. And that's going to be our focus today, everyone. We're really going to focus on summarizing that final consultation, because if you remember last week in Prep Hour 4, we looked at the first consultation. So today we're going to look at the final consultation. You'll see a few features as we go along. I'm just going to read the introduction and first paragraph. Some of the features of the first paragraph, because it's the first consultation, you'll see past perfect tense to describe symptoms that the patient had prior to that first consultation. You'll see some standard time references, which are very important to make the order of events clear to the reader, such as initially, 2 days ago, the previous 2 days, 3 days, 1 week ago, and so on. There'll be some linking words as well, therefore and along with. So let's just read it. So I'm not going to show you the case notes. I'm just going to read the letter so far, and then your job along with me is to complete this letter. So we've created the date. Imagine today is the 15th of February. We don't have to imagine that, do we? It is the 15th of February. So today's date, 15th of February, 2019. Dear doctor, so we're referring to a doctor. We got the patient's name, Amar Mustafawi, and we've got a date of birth. So he was born in 1962. So our introduction. I'm writing to request urgent admission for Mr. Mustafawi, a 57-year-old process technician who I suspect is suffering from a liver abscess. So now we know his issue. He's got a liver abscess. For the doctors here, I presume a liver abscess is quite a serious condition and does require an evacuation if you're in a remote area. Is that true? Whoops, let's go back. I like this introduction because instead of saying I'm writing to refer Mr. Mustafawi, we've been able to write a little bit more directly. So right in the very beginning, we can see we're writing to request urgent admission. So straight away when you write like this, you might see a lot of letters where I'm writing to refer, I'm writing to refer. It's very acceptable, especially in a non-urgent situation. But in this case, due to the urgency of the scenario, we're better to adjust our language to demonstrate that immediately. Now, doctors are confirming, thank you Ahmed and Joseph, that this is indeed, a liver abscess is an urgent situation. All right, let's look at this patient's history. Initially, he presented to me 2 days ago because he had not been feeling well and had felt a sense of weakness and nausea over the previous 3 days. He had stopped drinking and reduced smoking 1 week ago. So now in this introductory sentence, we're using a lot of past perfect here. Why are we using past perfect? Well, I'll just demonstrate to you so everyone's clear. If I draw a little timeline here, and I'm going to put a few little markers. Perhaps this is T for today and 2 days ago. So we'll call this the 13th of the 2nd. Today is this will be the 15th of the 2nd. So if we want to describe what happened with the patient up to, the patient's condition up to a past date, in this situation, it is nice to use past perfect. If we want to describe what happened on that day, on the 13th, just on one day, then we might use simple past for just one given day. Now that could be simple past. And if we want to describe up to now, in that case, we will use present perfect. And if we want to describe today, then we might use present tense. So it just depends what you're describing. I'll just type those in for you, showing you 4 different tenses. You always have to think, what are you describing? So there's a nice little rule of thumb for you, everyone. Use past perfect to describe events up to a past date. Use simple past to describe actually on that date. Then use present perfect leading up to today. And if you want to describe actually what's happening today, which we'll do shortly, we use present tense. So that's nice little time, and you should draw something like this up yourself as well when you're trying to understand the grammar. Make sure that's clear for you. Okay, let's go to the next slide. So we know he had stopped smoking and drinking and reduced smoking 1 week ago. All right. His examination was otherwise normal, except for tenderness over the right hypochondrium. So here we've used was normal because we're talking about today. So we've used simple past. Therefore, blood and urine tests were ordered and he was prescribed vitamin B and essential fort, along with advice to increase carbohydrate intake. So that's what happened today. up to now. So you can see the different tenses: past perfect for what the patient had experienced, those subjective symptoms. And the objective, what you did on the day, is all written in simple past. All right, let's continue. So now we're going to talk about this final consultation, and we're going to look at the subjective and objective history. And this is where we're going to use some present tense, because this is today, and that creates a sense of immediacy, or we can use another word, currency. This is now. So a writer, we often use present tense to describe current symptoms, because you're writing now, this is happening now, and most likely we expect that these symptoms or whatever you're describing won't change. It will still be present by the time the reader gets the letter and starts treating that patient. We can always use reported speech for when we're describing the subjective history, in other words, what the patient reported. And there'll always be a focus on the investigation results. Now, there were some investigations done. We can see that blood and urine tests were ordered. So we will see the results come out in this second consultation. So here we go, everyone. This is the final consultation. This is the day he's being evacuated. That's today's date there. And I want you to now look at your screen, and we're going to look at his condition, and then we're going to write a paragraph together. I'm going to get you to write in and help me write this paragraph. So what do we know? Well, unfortunately, his condition has deteriorated. He cannot tolerate fluids. He only drinks fruit juice, and notice that urine getting darker in colour with chills and rigor. So that's what the patient presented with. That's our subjective history. Now, moving on to our objective history, we can see that his temperature is elevated to 39 degrees. He looks jaundiced, so this is your observation. He looks jaundiced, dehydrated. So you did an abdominal examination which revealed a palpable and tender liver, but there were no ascites, if I'm pronouncing that correctly. No ascites. Investigations, so this was the previous investigations that you'd requested, showed normal stool and 2+ urobilinogen or bilinogen in the urine test. Leukocytosis with increased serum bilirubin and deranged liver enzymes, 2 types here, ALT and ALP, and I'm not going to try to pronounce the long medical names for these acronyms, were found in the blood tests. All right, so that's the first thing. This is the first paragraph we need to write, everyone. So this is where I want you to get involved, and I want members of the audience to start writing in. And I'm going to select some sentences that you've written and place that in our paragraph. Okay, maybe I'll start the ball rolling, and I'll say, I'll show you how to use it's a little bit a complex sentence with a time reference in it. So when, we'll call him Mr. Mustafawi, presented again today. So that's got us beginning. That's got us started. All right. I might even use I could add this, because his conditions got worse, we could show a bit of compassion. We don't have to do this. Like, got to be careful with unfortunately, but if someone's condition is getting worse, we can show a little bit of concern in our writing, because this is a human. So we can say, unfortunately, when Mr. Mustafawi presented again today, now what has happened? His condition, now I'm going to leave it up to you. I've got to start it. Can anyone complete this sentence? His condition Now we've got some words coming in. Today, Mr. Mustafawi reported that he had not tolerated food. That's good. Only fruits and drinks, and had noticed that the urine had turned darker. That's quite well written. Azadeh says, regrettably, Mustafawi's condition has worsened. Yep, as he has developed fever along with jaundice and dark urine. That's very well written as well. I'm getting lots of good sentences, and he cannot have foods and his urine is getting darker. Good, so lots of good sentences there. So let's try, his condition has, so we can use worsened, deteriorated. So we're using present perfect here. His condition has deteriorated, right? So that's following on from the previous information. So we're using present perfect here. Just so you know, if you wrote had deteriorated, it wouldn't necessarily be wrong. You do have the option to use past perfect because this consultation occurred earlier in the day. So it's one of the situations where you could choose to use past perfect or present perfect. All right, let's write some more information. But I wouldn't use his condition worse, and I would definitely be using past or present perfect because this deterioration or worsening occurred over time. So we need to express that. All right. So his condition has deteriorated. Now we want to talk a bit more about, we might say he reported that his urine, now when I say reported, I suppose we also have some options here that his urine was or is. If we wanted to use present, he reported that his urine is darker in color. So that's creating immediacy. And we might say, anything else we want to add to this? Now someone's typed in his condition was deteriorated, so I would say that's incorrect. We don't want to say was deteriorated. We have to express that this occurred over time. So remember that. His urine is darker in color and I might say and is associated with chills and rigors, which is a medical term, isn't it? Chills and rigors. So the body stiffening, I think, is the rigor, like rigor mortis. The body becomes stiff and is associated with chills and rigors. Now, just so you know, we could be using past here because it's reported speech. Just depends on what you're trying to create in the way you write. So sometimes people say, can I use this tense here or can I use that tense there? I'd simply say it depends. There's options available depending on what you're trying to convey. All right, let's move on to the objective history. So someone's written in, thank you for that. On examination, so we know we've immediately moved to the objective section. On examination, he was feverish. That's good use of good language there, so using your own words. He was feverish, jaundiced. He was feverish, jaundiced, and dehydrated. So we've grabbed all those important dehydrated, all those important facts. Then I would go full stop. That's enough information in that sentence. I'm going to keep going. So now let's look at the, someone wrote the abdomen examination, but we need an adjective. So we've got to say the abdominal examination. And now, so we're focusing on that, the abdominal examination, and then we can use revealed, or we could use showed, both acceptable. Revealed, what did we reveal? And Ahmed has written his liver is tender and palpable. Palpable and tender liver was found. That's all good. There's different ways we can write this. I'm just going back to some earlier comments. Zizi says, if I use simple past in the final consultation, would it be wrong? No. So that's why I put the options there. So there are different options. And someone's written in here, examination revealed palpable and tender liver. Okay. So I would say examination revealed what does palpable mean, everyone? A palpable, something we can feel, a palpable and tender liver. We've got to put an article because we're describing the liver here. So a palpable and tender liver. And someone said with no ascites. Yep. And you can say with no ascites, or I might say, or ascites. I hope that's correct. A tender liver without, and I'll just give you a different way to write this, without the presence of ascites. Just using it with a slightly formal style there, everyone. Right, a few comments have come in. His liver, Asade says his liver was enlarged and tender. And then I'd go, yep, full stop. His investigations revealed. Probably need to say which investigations. Don't have to say his. The investigations revealed leukocytosis, elevated serum bilirubin, and impaired liver function, together with urobilongin in the urine test. That's excellent, Asade. That's excellent. So we do have to give more information. So I will continue with that. And these were the previous investigations, weren't they? Investigations. And see how we're using a lot of past tense here? Investigations. So someone said, can we use past tense in this consultation? Yes, especially for your objective history. These are findings, so we should use past tense here. Investigations revealed, L-E-U-C, I'll just spell, that's a big word, K-O-C-Y-T-O-S-E-S, leukocytosis. Don't you love medical words? Investigations revealed leukocytosis, or cytoses perhaps in this case. Is that plural? Elevated. And we're using elevated instead of increased here. Elevated serum bilirubin. And impaired, that's a good word, and impaired liver function. So we're describing his liver function. His liver function is impaired. It is, isn't it? We don't even have to mention then the deranged liver enzymes. We're saying impaired liver function. So there's an issue there. Do you get the fact that it's impaired because of deranged liver enzymes? Is that what tells you it's impaired? Together with, there's a good joining word. Together with what? Together with Euro, one of those long words again. Urobilinogen in, and make sure you add the articles, everyone, in the urine test. So you've noticed how we're adding articles here. All right, we're doing well, I think. Lots of comments that come through. Let me check what other people have written. The investigation showed leukotosis with increased, we can't say with increased of, so someone's written with increased of bilirubin, not with an increase in bilirubin would work, and deranged liver enzymes, in addition to 2+ urobilinogen in urine. Yes, you can use the symbol if you wish. And Joseph wrote, elevated serum bilirubin and the presence of, good use of that word, urobilinogen in the urine, that's nice. Anna has written, there is repetition of revealed. Okay, good, yes. Thanks for pointing that out because I'm writing this live. So we don't really want to use revealed twice. So what we can do here, we just use showed. It is nice to show a bit of variety there. So well spotted, Anna. It's always good to double check. Now someone's saying, I noticed that there are no connectors. Well, there's a connector with on examination. It's a very good question though. Look, here's a linking word, even unfortunately is our adverb, gets us started. And then here we've got on examination. So that's a linking word. And down here we've got, and we've got linking words with associated with and together with. So there's actually a lot of linking going on in here, but not necessarily linking between sentences, because you don't want to say in addition, moreover. All these words can slow down the reader getting the information. They have their place, they're usable, but one thing I'd say when you're writing a medical referral letter, you want to be really objective. And that means you're presenting facts. So to the reader, a health professional, they don't necessarily need too many. You don't want to overuse signal words. Only use them if you need to make something clear. But here, it's very clear without that, without signal words, but we are doing a lot of linking in the sentence, which does make it very clear. Now, someone's written here, Molmer has written, hyperbilirubinemia stands for increased serum bilirubin, can be used instead in this long statement. Yes, good point. If you have the skills, the clinical vocabulary to use a more technical term which summarizes the situation as a doctor or whatever your profession is, then you do have that opportunity to use that. You do. However, if you want to if you're more comfortable using the language that's given in the case notes, then you can use that. A few more before we move to the next page. Asha says, furthermore, the investigation revealed leukocytosis, elevated serum bilirubin with an impaired liver function. Oh, we've done that one. That's great. Sarah says, could we use past continuous if the patient took a drug for a specific period in the past? Yes, the patient had been taken whichever medication prior to admitting to hospital. So yes, you can. Someone's asking, what's the difference between therefore, thereafter, and therein? Well, look, I think in the case of thereafter or therein, they're probably used more when you're writing essays or those sorts of things. I think for a referral letter, you probably would rarely use those sorts of words. But therefore you would definitely use. Therefore is cause and effect. Thereafter is what happened next. So it's an order of things. And therein is within something. Therein lies the problem. So you're going internal into something you've mentioned. And Amro says, is it necessary to use the word unfortunately? Absolutely not. You could totally remove unfortunately, and that's an optional thing. I believe it creates a sense of compassion from the writer, even though this is objective. You are treating a human, so you definitely can add that should you choose to, but it's your decision as a writer. And one more question before we move on. Norio says, in body paragraph 1, I usually write the patient's past medical history, social history, and current medication, and so on. In this case, in which body paragraph should I write these, or can I omit them? So Nordia, we've already covered that in the beginning. So this time we're doing this, the way we're writing this one is chronology focused. So we've already mentioned that. But if you do order of importance, this would be your first paragraph, right? You'd be a little bit of adjustment to it, but that's what it would be. So you have that option. And Mohammed says it's leukocytosis, not cytosis. Yeah, I had a feeling that could be right, actually. I agree. So perhaps that's just a little bit of a... I don't know if there was a plural form of this word. It came up that way in the case notes. So you can check this out yourself. It could be singular there. Okay, so we've summarized that section, but there's more, everyone. So let's go to our next page. We're not done yet. So now let's have a look what we've got. So we've done an assessment. Start IV fluids and medicate Rosafin 1 gram IV BD twice a day and Flagyl 500 mg 3 times a day. So this is what you did. You contacted the flying doctor service. Now we saw that image in the beginning. You contacted them for urgent ultrasound examination with a portable ultrasound machine. Isn't that brilliant? They've come in with a portable ultrasound. They've flown in with that. And the results of the ultrasound showed an enlarged liver. We've got the size, 20 centimeters, with a 10 by 10 centimeter cystic lesion in the right lobe of liver. So that's our ultrasound report. Diagnosis, liver abscess. What's the plan? Patient evacuated by Royal Flying Doctor Service with escort by an RN. So that's already happened. Arrange referral to a surgeon in Perth, Western Australia. So remember we saw the map of Australia. It's about 1,000 kilometres away from where the patient is. So that's what you're doing now. This is actually what you're doing. You are arranging this referral. Whoops. And it says urgent assessment required, including ultrasound-guided drainage. Writing task, refer the patient to the surgical registrar via the emergency department of the Perth General Hospital, and we've got an address there as well. So this is what we have to conclude with. So I'm looking forward to your comments here and how we're going to write this. So while I'm waiting, so type in everyone, and I'm going to look at some sentences. Abdo's written something, his condition had deteriorated. Is that active or passive? That's active, Abdo, because his condition had deteriorated. I'll come back to Joseph's comments. Mohammed says, can we say patient's condition has been deteriorated? No, that would be incorrect because you've used passive there. Now that's your passive, has been deteriorated. but you can say has been deteriorating, you're progressive, or has deteriorated. But we don't want to say had been deteriorated because that indicates something made it deteriorate, but it just happened internally within the body. Alas says there is debate about which method is perfect for the writing according to the importance or chronology. Yeah, there is debate, and look, have those debates amongst yourselves and look at lots of different examples. My opinion is they both very much have their place and are used. So it really does depend on what you're trying to convey, what you think is the best way to present that information. But you will find examples of both styles in medical writing. So like everything, it's not black and white, it's according to the situation. Joseph says, unfortunately, his ultrasound examination revealed an enlarged liver with cystic lesion in right lobe. That's good. We've got consequently he was treated. So I'm going to go back a little bit. I'll just write what someone wrote. So we could begin this sentence with, therefore, and we've got this, therefore, IV fluids. So you've got to use plural here. IV fluids. And what is Rocephin and Flagyl, everyone? What is, could I do this? Tell me if this is right. And antibiotics. And then I can use in brackets Rocephin and you have to tell me whether these should be capitals. Are these brand names or are they the active constituent? But you could do that. Therefore, I could say work commenced. I could say started. Work commenced. Now I'm going to look at a few other sentences, try to get something I like. Ahmed says, can I use present and past tense in the same paragraph? Absolutely, you can. It's different sentences. Each sentence can have whatever sentence you wish. But quite often we're going to use past tense for parts of our examination. He was treated, keep going. I herewith refer Mr. Okay, we're not on the introduction, Rojan. We're in the final sentence now, final paragraph. In view of the above, Rocephin 1 gram and Flagyl 500 mg per day was prescribed. Yep. You could say were prescribed for two things. The portable ultrasound revealed an enlarged cystic lesion in the right lobe of the liver. That's very well written. Yep, Ahmed is telling me these are brand names, so I'm going to use that. Okay, so let's continue. I'll give you something different. The flying doctor's service was contacted. The flying doctor service was contacted, and through their, we don't have to go to all of this detail, but I'm just going to show you we can, through their portable ultrasound machine, a 10 by 10 centimeter liver abscess Now, what are we going to say here? a 10 by 10 centimeter liver abscess. I'll see if I can use your words, or a cystic lesion. Could I put here, would this be correct? Was diagnosed? Or we could say the ultrasound showed, probably I like that better, an ultrasound showed an enlarged liver on the 10 by right lobe cystic lesion. Yep. Wow, there's lots of comments coming in now. I don't know if I can keep up with all these. And now we're going to move on. Let's move on. I like that Russia's sentence. The portable ultrasound detected an enlarged liver. That's great use of the word detected, together with a cystic lesion in the right lobe. That's very nice. That's very nice. I might change this. So the portable ultrasound and through was contacted, and I'm just going to go, and their portable ultrasound machine, let's just change it, detected, just because I want to give you some variety. Detected an enlarged liver, detected an enlarged liver together with a cystic lesion, a cystic lesion in the right lobe. Now we could say right lobe of the liver, but because we've just mentioned and we already said together with somewhere else, so I'll say along with, just for some variety, along with a cystic lesion in the right lobe. Put in brackets. I'll leave it like that. We could say of the liver, but we now know the topic. Maybe we can do as a result. Now, what else are we going to do? As a result, are we going to mention as a result, could we say, I suspected a liver abscess? Let's have a look at some sentences we've got. I don't even want to use, let's do this. I've just done a different way here. Let's continue. The plan, everyone, the plan. Could I say this, everyone? Is it a provisional diagnosis or a real diagnosis here? What do you think? My provisional, doesn't say provisional. My provisional diagnosis is a liver abscess. We can even use present tense there, because to illustrate some currency that this is now. A diagnosis of liver abscess was made. I won't say right liver lobe. I'll say the right lobe of the liver is better. I'll just, in case you're confused, I'll just add that. Notice we put the article. Now that's optional. As a result. Okay, let's finish this off, everyone. We've got to get this patient quick as possible. The patient's on the way. We need to send this letter off. You've had a very busy day. You've got to complete this. So someone's written some nice sentences for me here. I'm just going to go and find a nice one. Just go back a little bit. help me out for the final bit. Okay, so we got to say the last bit. How are we going to end this one, everyone? How are we going to end it? So we got the plan, everyone. So patient evacuated by the flying doctor service with escort by RN, registered nurse. Arrange referral to surgeon. We don't have to say that. Urgent assessment required. But we're going to put that last bit in now. We could mention possibly in the conclusion, but we've already said urgent assessment in the beginning, but we haven't mentioned ultrasound guided drainage yet. So I think we need to mention that there's an ultrasound guided drainage, and perhaps the patient was evacuated. What about this one? The patient was evacuated, and we don't have to mention flying doctor because it's obvious, right? The patient was evacuated under the escort of a, we just say registered nurse. And then I might say, and requires urgent assessment and ultrasound guided drainage. How does that sound? Does that sound okay? I'll check what you've written. In view of the above, I believe he needs urgent assessment and ongoing treatment, including ultrasound guided drainage. That's excellent. And Ahmed's written, I believe Mr. Mustafa needs an urgent abscess drainage. Good. Therefore, I'm referring him urgently, escorted by a nurse. Your urgent assessment would be highly appreciated. Should there be any further queries, don't hesitate to contact me. That's good. Maymol has written, as a result, an immediate evacuation along with the respected doctor and an RN that's not quite right, was advised the last section there. Please note he's due to be transferred to your hospital, but I wouldn't say due to their USADA because this has already happened. He'll already be on the plane when you're writing this. So I like past tense here because he's already left. He's gone. So I think past tense is better there. And I'll just end, simple concluding sentence. If you have any further query, just a standard one, do not hesitate to contact me. Maybe by that stage on exam day, everyone, you're not going to have a lot of time. So a nice, simple one. Or you could say, I would appreciate it if you could keep me informed of the outcome. How about that as a different one? Run out of space there. I would, okay, now we run out of space on that page. But just verbally, you could say, I would appreciate it if you could keep me informed of the outcome. And then you simply end with yours. Oh, we're not getting typing on this page anymore. I think this page is full. Okay, but you could say something like, you know, just end with yours sincerely, doctor. It's always nice to end with yours sincerely. So we're done, everyone. We've just written our final two paragraphs. We've used some, let's have a quick look at it before we go to the next page. So we've said what we commenced the patient on. We mentioned the context. I think it's always good to add contextual information so they know what happened, that the flying doctor was contacted and their portable ultrasound machine detected. You could simply say, and ultrasound detected. This is just a little bit more detail. Detected an enlarged liver along with a cystic lesion in the right lobe of the liver, Probably I would add that. As a result, my provisional diagnosis is a liver abscess. So I've used present tense just to indicate this is current, to create that immediacy I mentioned before. But here I've gone back to past tense. The patient was evacuated under the escort of a registered nurse and requires. So this is now present tense. He requires, because this is, so we've not used past tense here. This is a current requirement. So we've gone to present tense, and requires urgent assessment and ultrasound guided drainage. And then just a really short standard conclusion, which really technically is not part of the body of the letter really. We could even just say yours sincerely. If you've got time, you can add this as a polite closer. That's all it is. Okay, so there we have it, everyone. Any final questions? Feel free to let me know. How do you like it? Joseph says that's good. I hope you like this draft. Someone said no article. No article before ultrasound. Well, I suppose urgent and ultrasound, because I suppose you could say requires urgent assessment and ultrasound guided drainage. We could put an article there. However, because drainage in itself is uncannibal, it's quite acceptable without the article. Just go through a few final comments. Asha says we didn't mention social or medical. I think, well, we did mention past in the beginning, Asa. We did mention the past history. Have a look at the video after, you'll see it. The social history wasn't here. This is a bit of a condensed version for this purpose, because I really wanted to focus on this final paragraph or an urgent admission. So I wanted to focus on the case notes. So this is just a short form. All right, lots of good sentences. I think I've answered all those ones. An article is needed and ultrasound scan. So someone's mentioned that again. So as I said, therefore, so we don't need an article there, and I explained why we didn't need this article. Although it's optional, you could put an article there. All right. Thank you, everyone. Hope you found this really helpful, and it helps you write at, with control and accuracy when you're summarizing those case notes. Now, next one, we're going to be doing another one in 3 weeks' time. We'll keep you informed. This was a doctor scenario. Next week, we're going to get one out there for you nurses out there. So we'll look forward to that one. I just want to tell everybody. So as you know, I'm Steve from OETonline. I thought I'd let you know we got some great new material available. In case you haven't been there, come to our website, oetonline.net.au. Some really nice new courses on what's called an economy. Really nice if you need a quick final preparation before your exam. Includes writing correction and one speaking lesson with a private tutor. We've introduced a new standard, everyone, and a new premium. Really well valued courses which include virtual classes, which you'll find me teaching on along with other members of the OETonline teaching team. Check out the website for details, but really nice courses. Don't forget, if you need a placement test, if you want to know your level, we'll enroll in our free trial course. It gives you an understanding how study works with OETonline. We are offering placement tests, so you can check out your level and get personal guidance on what course is best. And if you're in Brisbane, everyone, we're doing weekly admissions. So every Monday here in Brisbane, between 8:30 and 9, we're taking admissions. So you can choose between 1 week all the way up to 6-week course options. Lots of great choices for you to ensure you pass OET. Thank you very much. Wishing you good progress and a good exam result soon. See you in the next session. Goodbye.